Congressman.
Sarah, thank you very much. Hi, this is Tom Cole, and let me start off with trying to put a little bit about coronavirus in some sort of perspective, because that's clearly been the dominant issue in front of Congress and really in front of the nation for the last several weeks. It's important to know at the beginning that what we're facing isn't really an economic crisis in the classical sense. This isn't like the Great Recession or a typical economic downturn. This really is a public health care crisis that has severe economic consequences. And that's because the things we need to do to deal with the health care crisis actually have really quite far-ranging economic consequences. If you remember, at the end of February, the economy was roaring along. Record job numbers, the lowest unemployment in 50 years, the highest consumer confidence in 20, the fastest wage growth in over a decade. So clearly there wasn't anything wrong with the economy, but there was a lurking challenge out there, not economic in nature, but very important from a healthcare standpoint. Now, from what we can tell, this is, remember, a brand new virus, and it probably emerged, it certainly emerged in China, probably sometime in September or October of last year. But it took time to recognize, and frankly, the Chinese were slow to recognize it, and frankly, very slow to communicate with the rest of the world that they had a problem. And that's probably compounded the challenges we faced. Nobody in the United States government really knew anything about this until literally New Year's Eve, December 31st of last year. So we've been dealing with this now for all of about 10 weeks. The first person that was alerted was our director of the Center for Disease Control, Robert Redfield, and he was alerted by his Chinese counterpart that they had a problem and they thought it was going to expand beyond their borders. Now, to be fair, Congress has actually been thinking and preparing for this kind of challenge for a long time. Over the last 5 years, didn't matter who was president, the Congress increased funding for the Center for Disease Control by 24%. In the same period of time, we increased funding for the National Institute of Health by 39%. National Institute of Health is where we'll develop ultimately the vaccine. The CDC is where we'll develop the initial diagnostics and therapeutics, as it's called. That is how you treat it, not how you prevent it. We also increased the what's called the strategic stockpile. That's where we keep extra ventilators, masks, vaccines by 34% in the last 5 years. And we set up something which turned out to be really wise in retrospect, the Infectious Disease Rapid Response Fund, about 2 years ago, and put money in there, 3 years ago actually, 2 years ago, put money in that fund so that if a crisis arose anywhere in the world, we could begin to respond immediately. And frankly, we did, and that's actually bought us a lot of time. So we go into this literally, according to the survey by Johns Hopkins University, which looks at every national healthcare system in the world and their ability to handle a pandemic. We're rated number one out of 195 countries. So the preparation certainly has been there. Since the problem was announced, quite frankly, there was almost an immediate response. The president declared a national health emergency in early January, and he immediately imposed travel restrictions to and from China, quarantines on anybody coming in from China that had any kind of symptoms at all, and the Center for Disease Control immediately began to develop a diagnostic test so we could make sure who had it. They had that done, by the way, by January 6th, record time, and the travel restrictions probably bought us a lot of time. Since early January, and again, that's, remember, 10 weeks ago, less than that, there's been a series of executive actions. That is, later travel was banned to Europe and from Europe, except for American nationals coming home for a 30-day period. And that's because the disease had gotten out of China. We knew it was bad in surrounding countries like South Korea and Iran, but about 60-70% of the new cases in the world by early March were coming from Europe. And obviously there's a very robust travel back and forth between Europe, honestly, just as there is between Japan and China and the United States. So those restrictions were imposed by the president. Again, quarantines. And there were also, because of concerns about the economy, additional actions out of the executive branch. You'll notice interest rates have been slashed. The Federal Reserve has interjected money in the economy, etc. So again, a pretty robust executive response. In Congress, there's also been a lot of focus on this, really beginning early. Remember, the initial tools that were used, Congress had put in place. That is the Infectious Disease Rapid Response Fund, 2 years ago. That started being used in January. In addition to that, Congress approved and gave the Health and Human Services Agency, where the CDC and the NIH, forgive me for all these government acronyms, are both located, the ability to move money around within its budget and apply extra resources. Eventually, it was decided about 2 weeks ago to supplement those resources with what's called a supplemental or an emergency appropriation of about $8.3 billion. Most of that money, over $6 billion of it, went to Health and Human Services, and it's flowing now down to in several directions. Some of it's coming to state and local health departments. Oklahoma recently got its first grant from Health and Human Services to help us deal with this crisis. But most of this money's being spent to speed up, the development of vaccine and therapeutics. That is the different kinds of things needed to actually treat the disease. We would expect new therapeutics to come online probably in the June time frame. That is, new ways to treat. They're being tested now. And then to develop a vaccine takes a minimum of a year to 18 months. So that's probably, again, at the very end of this year at the earliest, more likely into early next year. We also set aside money to help bring Americans back in affected regions and to make sure, if necessary, they were quarantined for 14 days. We also strengthened what's called the telemedicine network in the United States. That is to make it easier for doctors and nurses, healthcare providers to be able to work from a distance, both to diagnose and treat illnesses. That was passed, again, about a little over 2 weeks ago. Passed through the House without any major opposition, 415 to 2. Passed the United States Senate 96 to 1. So not a lot of partisan fighting over this sort of stuff. Then late last week, Congress added a new supplemental bill, and they worked very closely with the White House on this. This was, again, a very bipartisan measure. And the idea here was to provide tools for families and workers that were impacted by the disease and to help small businesses through this crisis. So paid sick leave was given to everyone. If you're sick, well, you're going to get paid. Please don't come into work, whether you normally have sick leave or not. The business is going to pay you, and then they'll get tax credits to recoup 100% of their costs. This whole package was about $104 million. It also provided that all testing, there would be free testing for people that had no health insurance, no ability to do things. This bill was really moved through quickly, and so a number of members were worried about it because they didn't have time to read it as thoroughly as they would have liked. It was introduced Thursday. It was negotiated Thursday, all day Friday. Changed quite a bit between Democrats and Republicans and the administration, but everybody wanted to get to a good deal. It eventually passed the House of Representatives, I think something like 370 to 40, so it was overwhelmingly approved, substantial majorities on both sides, and it passed the United States Senate today 90 to 8. So again, so far, very strong bipartisan measures. Now, in addition to that, because you can see, if you watch the news and you just watch what's happening in your local businesses, as restaurants can't do anything other than curb service and carry out, and you see, Disneyland closing down and cruise lines closing down and flights being limited, all because we're trying to limit the exposure of people and the travel of people. all that slows the economy down. So right now the Senate is working on a third bill, a stimulus package, and it's working closely with the White House and frankly with the House of Representatives as well. The bill will probably start in the Senate this week. We don't know when it will pass. It could be by the end of the week. It could go into next week. It'll be a huge bill. It'll be something like $1 trillion to $1.3 trillion. It'll have everything from guaranteed loans to small businesses to, once criteria are developed, cash payments to Americans, particularly those who lose their jobs, hourly workers, people that, can't come into work. There'll certainly be money in there for the airlines industry so that we don't lose that. But all that's being negotiated right now, and we'll see where we actually end up. The hope would be that, like the first two bills, it'll be largely bipartisan. Last point, and then we'll open it up. You're also seeing now a pretty vigorous state and local response. The two largest metropolitan areas, both mayors have limited the hours of operation, basically closed down restaurants and bars other than carry-out services. All your major events have been suspended or postponed. Of course, the Oklahoma Thunder game was probably the most dramatic incident. A lot of this stuff is now being driven not by the government, but by private sector people taking action on their own. Nobody in the government ordered the NBA to suspend their season or the NCAA to cancel March Madness. Those were done by the heads of those respective organizations after they consulted with experts in the field. So a lot of that's happening. The governor, of course, in Oklahoma has declared a state of emergency. He's held press conferences the last couple of days. We had a conversation, when I say we, the congressional delegation and the governor, to discuss what the needs of the state might be in terms of additional federal assistance. So we had a very good, frank exchange of views as to what we could do. They're working with us to try and make sure that we put in requests and language that are specific to Oklahoma's needs. And of course, all this, in the case of our state, is compounded by the oil and gas crisis, which is not directly related to the coronavirus, but to a production war between the Saudis and the Russians, where both of them honestly have the same long-term interest, and that's to weaken the American domestic energy industry that's made us independent of foreign oil and natural gas. So that's a whole nother area that adds to the economic challenge that we're facing as we deal with the coronavirus. I will tell you, from what the experts say, obviously this will go on for a while. This isn't something that will be over in a week or a month. But there is another side to this. China, where the original outbreaks occurred, we now have very few new cases, and they're sort of reopening their economy. So, the quicker we get on top of it, and slow down transmission and catch up and develop therapeutics, the better off we'll be. But there will be another side to this. Last point is that, I would just urge you to listen to your healthcare professionals. If you think you've got symptoms of anything, for goodness sakes, stay in, call your doctor, let them know, follow their advice. Don't show up in the emergency rooms if you can possibly avoid it. That's part of the concern in South Korea, indeed, and particularly in China and Wuhan, where this began. They overwhelmed the medical system, literally more people pouring in than they had beds or could take care of. And they got down to the point in some areas, Italy's another one, Iran appears to be another, where they had to ration care. We want to avoid that by being smart and people not exposing themselves, being careful, practicing the new phrase social distancing as much as is practicable. Just to give you an example, my office now is fully functional, but everybody's basically working from home, both in Washington and here. So if you've got a case, a veteran's case or something, you call into our number. It's routed to the home of our folks that deal with those kinds of cases, and they'll continue to work with you. But we're trying to minimize, interactions between individuals. And certainly, normally when you're on a break, you're doing events and public town hall meetings. At the advice of healthcare professionals, all that's of course been canceled. This teletown hall is really our electronic substitute, and we're going to be trying and having a number of these going forward, more than we normally would have, in order to try and keep you informed as to what's happening and answer any questions you might have. So with that, that's a long overview, but I think that's the topic du jour, although we're happy to talk about anything else that you might care to raise on the call. So Sarah, ready to take questions whenever you're ready.
Sure. Yeah. And just a reminder to everybody on the call, if you would like to ask a question, press 0, and then you'll be able to record your question and then return to listen on the call. Our first question comes from Joe, has a question about the economy, and he's from Oklahoma City.
Okay. Hey, Joe, this is Tom Cole. How are you? Joe, are you there?
Yeah, I'm here.
Okay. We'd love to hear the question.
Yeah, the question, sir, is with the drop in the price of oil and the way the prices have been coming down, what are we doing as a nation and also as a state to try to stave this off? Because in the end, it's really going to hurt us really bad.
Yeah, no, you're exactly right about that. I mean, in this district, there's an awful lot of oil production. The two most productive counties in the state are in the 4th district. And, of course, lots of not just the bigger companies that people recognize, but small oil field companies that produce pumps and valves and you name it. The first thing the president has done is begin to fill up the strategic oil supply system again, or oil reserve. And so the United States government is now in the market buying a lot of oil in an effort to stabilize the price. That will put that away in storage, obviously, and save it for a future rainy day, if you will. The president's also looking at, and I think you'll probably see some of this in the next stimulus package, what can we do in terms of both loan guarantees and tax incentives for the energy industry. And again, the greatest single strategic advantage the United States has gotten in the last dozen years or so was literally becoming essentially North American energy independent. That's been a really good thing for our country, really frees us up from dependence and gets us out of conflicts in the Middle East and what have you. So we need to maintain that capability. At the state level, I'm not sure. I'm sure they're thinking about it because this impacts their budget very, very directly. But we'd have to talk to your state representatives and the governor about that. And I've been focused on the federal end, so I'm not sure what they're thinking about at the state level.
All right. Well, let's move on to our next question. Sandra from Oklahoma City.
Hey, this is Tom Cole. How are you?
I guess that's me.
Yes, ma'am.
Hello.
Hi.
Yes. Excuse me. My concern is with all of this bills being passed immediately, very quickly, if some people are stacking it or putting stuff in there that people don't have time to read and it becomes law. If that is so, do we have a recourse immediately to fix it if someone wants to put something in there that we don't want?
Yeah, we do actually. Well, great question, and you put your finger on a real risk. There's no question when you legislate in haste, you can have problems. But the sense has been from the president and really from both sides of the aisle to try and move quickly. So we're having pretty good discussions, but I think people are trying not to take advantage of the situation, but they are being very very assertive in trying to defend the interests of the areas that they represent, the states they represent, the industries that might be important to them. So I can tell you these bills are being scrutinized probably more than most legislation, and Congress can always come back and undo anything that it did. And I think if there was a sense that somebody was doing something inappropriate, probably they'd pay a heavy political price for it, and Congress would act pretty quickly. But all I can tell you is most of this is being read and reread. I would like it if we moved a little slower, but the reality is with the economy taking as big a hit as it can, the sense has been that it's better to act rapidly. That's what the economists tell us, and certainly I think that's where the president and the congressional leaders on both sides want us to go.
All right, we're going to move on to our next question from Lillian.
Hi,
Yes, are you there?
Yes, I am.
Yeah, I was just basically wondering what they're going to do about the supply chains in the stores, because you go into any store now and, the shelves are barren, so what are they going to do to replenish the shelves in the stores for people to get supplies?
Well, the president has met with the leading retail people, everybody from Walmart to the Costco's to all those people. They're redoubling efforts. A lot of our problem here is, frankly, we got a lot of people buying a lot more than they're ever going to need. This is not the time to buy 2 years worth of toilet paper, things like that, because all you do is put other people in the lurch. So we have no reason to believe there's not going to be plenty of things coming, plenty of food, plenty of the basic staples. Everybody's staying open, working with people. You're not seeing Walmart's closed down, grocery stores, anything like that. So I would just ask people, buy what you need by all means. But for goodness sake, we had some guy in New Jersey that bought something like 18,000, hand sanitizers. Come on. You couldn't use that much in a century, and the only reason to do that would be to try and profit from it illegally, which, by the way, is a federal crime if you're caught doing that. So if people will just buy reasonably, I have a lot of confidence that our retailers and our grocers and the folks that make life pretty easy for us compared to most other places in the world, they're moving product very rapidly. We're not running out of anything. It just sometimes we have people buying more than they need, and there's a delivery schedule, and people have to wait between deliveries to get it. So best thing we can do is just buy what you need and not overdo it. But we don't have any evidence that we don't have the ability to provide the food and the wherewithal that everyone needs.
All right, we're going to move on to our next question, but just a reminder that if you would like to ask a question, press 0 and you'll be able to record that question and then return to the call to listen. And then also if you would like to opt into future telephone town halls like this, press 1. Our next question is from Mike. He's from Norman.
Hey, Mike, this is Tom Cole. How are you?
Just fine.
Good.
I have a question for you.
What's your question?
Yes. You have a date that the Oklahoma may start receiving some test kits for the COV ID?
We should actually by the end of this week start to get them. We have been getting some. We're not one of the worst affected areas, so the initial distribution has been heavily skewed probably toward the coast. California and Washington in particular, badly hit. New York, the places where there's the most transocean traffic and where there are literally ports of entry into the United States. We don't get foreign flights directly into Oklahoma City, so that's probably been the biggest single reason. But we are all talking to the appropriate authorities. When I say all, the entire congressional delegation, and the testing has ramped up pretty considerably. And so I think we'll get there. We're not where we want to be today, but we're making progress.
Great. Well, we'll move on to our next question. Again, if you want to ask a question, press 0, and to opt in to future calls like this, press 1. Our next call is from Manny from Newalla.
Hi, this is Tom Cole.
Hi, sir. How are you?
Good, thank you.
Great. Well, my question was, I'm on a fixed income. I receive VA benefits, and I was wondering, does this stimulus money come to people that are on fixed incomes also? Because my children being out of school for the complete month has kind of tapped the budget that I do have, so I'm kind of strained for basic necessity.
I can't tell you that yet because the legislation hasn't been finalized. My hope would be that it does, that it's targeted toward, frankly, folks that are in more challenging circumstances, either that are in the affected industries or certainly that face challenges like you do. Again, once you, pull kids out of school, you really increase the cost and challenges for lots of families. So I think that should be taken care of, but I can't tell you with certainty yet because, again, we have not yet seen the text of the legislation. They just got the second bill passed today. They probably have started on this in the last couple of days. I know our leadership in Congress on both sides of the aisle has been, for instance, I'm on both Rules Committee and the Appropriations Committee. We had a teleconference of the entire Rules Committee today and got their suggestions of what they wanted. We'll do appropriations tomorrow morning. So these items will come up. I'd be happy to make sure that it's brought up for consideration. So we'll try and work on that. But from your description, I would say you would certainly fall in the category of people that ought to be getting help.
All right. We're going to move on to our next question. If you would like to ask a question, press 0, and to opt into future telephone town halls, press 1. Our next question is Paula from Norman.
Hey, Paula, this is Tom Cole. How are you?
I'm fine, thank you. What my question is how are we going to raise the money to put back in that we're taking out?
Well, a lot of what we put in will be loans, particularly to businesses. And people forget this, but in the so-called bank bailout, the federal government actually, at the end of it, made over $50 billion because the banks paid back everything they borrowed. So that's number one. That won't be true with the individuals, so no question, but they're going to end up losing their job. So one way or the other, you'd be paying through unemployment. Now, again, part of if you get expedited unemployment, that's money we already have. That's in a reserve fund. You pay unemployment taxes every month if you're working. So if you were to lose your job, you're getting back a benefit in unemployment that you should get. But no question, part of it will be borrowed money that won't be repaid, and we're going to have to come to grips with that longer term. But in the emergency, you got to take care of people. So that's where we're at right now.
All right. We're going to move on to our next question. It comes from Esta, and she's from Pauls Valley.
Hi, Esta. This is Tom Cole. How are you?
Hi, Congressman. My question is, they have closed down a lot of small hospitals in Oklahoma. Why can't they reopen these hospitals in the event of needing hospital beds?
That's an interesting suggestion. In some places, actually, in Pauls Valley, where you're at, obviously we lost a hospital. There is now a healthcare operation there with the idea it will eventually come back. This is a separate issue from coronavirus, but there is, we are looking at ways in which we can continue to put additional money into particularly rural hospitals. That's where most of the closing has taken place. It hasn't happened all that much in metropolitan areas. So all I can tell you is I don't sit in the area that the committees that do this, but I'm on a couple of task force where we're trying to figure out how to put more money into rural health care. Some of that, honestly, and I'm not taking a position one way or the other, but I think both the governor has a proposal for Medicaid expansion, and it'll probably be on the ballot later this year. That will impact the fate of rural hospitals as well, because either one of those plans, either the governor's approach or the existing Medicaid expansion, would probably provide more money for rural hospitals.
All right. Our next question comes from Kim from Ada. But before I bring her on the line, just a reminder that if you would like to ask a question, press 0. And to opt into future town halls like this, press 1. Kim, you're live.
Hey, Kim, this is Tom Cole. How are you?
I'm good, Tom. How are you?
Good. It's Ken. Is that right?
Kim. K-I.
Oh, it is Kim. Okay. Very good. Sorry, I just wanted to make sure I wasn't messing up the name.
No, that's right. Hey, I'm a landlord here in Ada, and we've heard rumors that maybe they're going to suspend the mortgage payments and people wouldn't have to pay their rent and stuff like that for a month or two. And we're just kind of concerned as landlords as to what that would do to us, because we still have bills to pay. We still have to maintain, and we're kind of concerned about what the situation would be, and whether or not that's even true is something that they're considering.
As far as I know, the answer is no. Now, the HUD has said they're not going to evict or foreclose. And again, I don't know if you have, like Section 8 housing or something like that. But so they're going to be very careful as people work through this, not to throw people out of their homes. But I have not heard of anything at all that would alleviate people's requirement to pay their rent or pay their mortgages. Matter of fact, some of the cash payments, and right now they're talking about 2 cash payments. And again, this isn't for everybody. Not everybody needs a cash payment. If you've got a regular paycheck coming in, you certainly don't. But we want to make sure that people are able to keep their, rent payments up and their mortgage payments up and those sorts of things. So the efforts to try and help people that are sort of on the margin, fulfill those things, not to alleviate them of those responsibilities.
Okay. Our next question comes from Melissa from Lawton.
Hi, Melissa. This is Tom Cole.
Hi. Thank you for allowing us to have this opportunity to ask questions. And my question is concerned. Go ahead. I'm sorry.
No, I would just thank you for taking the time to stay on the call.
Thank you. My question concerns veterans that use the facility like at Reynolds Army Hospital, and we have to go there to take brand new prescriptions or pick up, refills. And the way they've set the system up, you're required to go in person for any new prescription. So we're sitting there for an hour or 2 hours, and you might have a lot of people involved, and they're trying to, take that risk away. Is there a way they can make it where physicians can just call in brand new prescriptions and not have to be right in person to do that and stay in there a long time?
That is a great idea. I don't know, but I will certainly suggest that legislatively. I know there's going to be in the next supplemental some things on veterans health care. We want to make sure that system is really robust. And I know there's going to be, and frankly, there's additional legislation that we're working on with a group of others, including a guy named Brad Winstrup, who's a former Army combat surgeon. Matter of fact, he's the guy that saved Steve Scalise's life when he got shot, the Republican whip. And he's working on some things to try and make sure that this stays more robust and we're able to give veterans better care. So let me look into that, but that's a great suggestion and see if we can do something. We certainly, at this point, don't need people hanging around hospitals where we want to minimize their time in places like that and get them what they need without running any risk that they get exposed to coronavirus.
All right. Our next question comes from Bill from Lawton.
Hey, Bill. This is Tom Cole. How are you?
I'm fine, sir. How are you?
Good, thank you.
I have a couple of questions. One is that the last time we had this call right here, you mentioned that we have a shortage of doctors. I just wonder, is there any way that the government can assist these young men and women who want to be a doctor with some of their financial obligations they have? And the other question I have is my second question is, looking at this virus we have, and I understand a lot of the pharmaceutical medicines are made in China, and then those compounds are sent to the States and then are mixed here. Is there any way that we can, that the president can get those companies out of China or out of any other country, bring them back to the United States, and do that work here?
Those are two great questions. We have a variety of programs to try and increase the number of doctors. Everything from loan forgiveness programs, if you'll go and practice in underserved areas, which is quite often in rural areas or inner city areas. We try to skew that more toward general practitioners. We have lots more specialists than we do general practitioners, frankly. We also have some programs. OSU actually has a great program to try and establish residencies and put folks from rural communities that want to practice there back in those areas. So we're actually spending a lot more money in this area, and I think we'll continue to try and think of additional ways. But the biggest challenge is just a hard life. I mean, it's very well paid compared to most other professions, but the cost of going through medical school is very high. The challenge is long. It takes a long time to do. So a lot of people opt to do something else, and we can't make you be a doctor, but we certainly can do some things to make it more attractive if you've got an interest in doing that. And I will tell you, we're working pretty hard on that, and I think beginning to have some progress. The second question, I went blank here for a second. Mike, can you remind, you're still on, can you remind me? Sarah, do you remember?
Oh, I don't. It had something to do with the vaccines.
Yes, supply chain. Yes, thank you very much, Sarah. And thanks again. That's a great question. Number one, there is a lot we can do. There's actually legislation. Right now, just to give you an example, we protect parts of our industrial supply chain because we don't want to be dependent on things that are important in our weapons systems from abroad. So, we don't build Navy warships in South Korea. It might be cheaper, but we build them in Pascagoula, Mississippi, and shipyards around the United States, and we pay a premium for that. But it's important to maintain that capacity here. We may well do that. I don't think most members of Congress realize how much of our supply chain was dependent on China. Now, to this point, they certainly have not held back anything. We've not suffered any shortages of supplies, but you always run that risk. And certainly, you got to expect that the factories in a particular country, that country is going to put its own needs if it's caught in a pandemic ahead of anybody else's. So all I can tell you is the light has gone off in Congress. I think you'll see major legislation on this. As a matter of fact, I would not be surprised when this is over if we see a sort of 9/11 type commission on what are the lessons learned, not to cast blame on anybody, but what are the things that we can do. Again, as I pointed out in my opening remarks, Congress has done quite a bit in terms of additional money for the last several years. I mean, we had a number of these outbreaks, SARS, MERS, Ebola, Zika, things like that really woke congressional thinking up over the last few years. So Congress has actually put more money in the Center for Disease Control, the National Institute of Health, the Strategic Stockpile, and the infectious disease fund, which really, I'll be immodest. That was actually my idea, and we put it into law, and it stood the test of time, and people like it a lot. So Congress has been on this, but we had not thought through the supply chain in probably the way that we should. So I suspect we'll be looking at this going forward, and measures will be made. I know there's one piece of legislation that says we buy a lot of pharmaceuticals for the military, for instance, and for our veterans, that maybe all those need to be made in the United States. Again, I haven't studied this idea yet, and certainly if we did that, the cost would have to be absorbed by the American taxpayer, not by the individual veteran or something or soldier using the medicine. But I think this is going to get a lot of attention as we go forward, because nobody is comfortable with the United States being dependent for something this indispensable on the supply chains that are dominated by other nations, particularly in the case of China, with a country that's quite clearly a competitor of ours. This isn't England or Canada we're dealing with that are close allies.
All right, we're going to move on to our next question. If you would like to ask a question, press 0, and if you would like to opt into future telephone town halls, press 1. Our next question comes from Lucas, and he's from Duncan.
Hey, Lucas, this is Tom Cole. How are you?
I'm good. How are you today?
Good, thank you.
Yeah, my question was about like bigger companies like distribution centers and as such. Like, do you feel like this is going to affect those in any way? Are they going to be shutting down or?
It really depends on the company. For instance, Amazon is hiring like over 100,000 new people, including 1,400 new people in Oklahoma. Walmart, stock is at its highest ever. So a lot of these companies that either indispensable points of distribution or specialize in home delivery, that kind of thing, probably has been helpful to them. So I actually don't see the distribution network being damaged in this. The folks that are really getting hurt the most are the businesses. Obviously, anybody in the entertainment business, because you can't track crowds. Anybody in the hospitality business, like restaurants, whether they're your mom and pop diner, and I was on the phone today to the head of a company that runs an assortment of restaurants like Olive Garden and variety of different restaurants, Capitol Grills all across the United States. They have like over 1,800 restaurants, over 190,000 employees, and obviously nobody's coming in to eat right now. They can't. Those are the kind of folks that are probably most at threat, along with the transportation industry. And you've got to have an airline industry, particularly in a country the size of the United States. We're still moving, by the way, lots of cargo by air. We're just not moving many people. It's sort of like, I know probably a lot of you caught earlier today that with mutual consent with our friends in Canada, we're sealing that border. There's not going to be any non-essential travel back and forth, and that's the longest undefended, open, friendly border in the world. But the cargo is still going to move back and forth, because we do a lot. Canada is our first or second largest trading partner. They're bigger than China, and we're there by far their largest trading partner. So the last thing we want to do is cut off trade back and forth. So again, there's certain industries it really varies, and that's one of the things we're trying to do in the legislation that'll be next. And again, I wish we had more time to do it, because as a caller earlier pointed out, you move too fast, you can make mistakes. But the economy is, as we take these public health measures, taking an enormous hit, and we've got to do something to revive it and make sure the key sectors that are being hit disproportionately right now, get special help to get them through it so they can get up and running when we get to the other side.
All right, we'll go on to our next question, and this one comes from Lynetta from Berneyville.
Hi, Lynetta.
Good afternoon, sir. My question is about the farm program and our food supply. Is this food supply, I know it will get worse, but is it going to come out of the farm program?
No, it's not. Farm Bill's in awfully good shape. As a matter of fact, there'll probably be some additional nutrition programs. There was in the second supplemental that the Senate just passed, extra money to make sure nobody. So this actually should be pretty good for agriculture, and nothing we're seeing now really disrupts anything in the food supply. That is, our biggest problem is people buying more than they need because they're afraid. It's sort of like, I was listening to the news earlier, and a lot of people stocking up on ammunition or guns or whatever. There's nothing here that should undercut the food distribution program in the United States, and certainly nothing that would undercut the farm program. So we've passed the Farm Bill. Our expert on that is my friend Frank Lucas from Western Oklahoma, who's actually in production agriculture. His family still farms the land that they've farmed since 1893 out in far, far western Oklahoma in Roger Mills County. So those programs are in good shape, and frankly, we'll continue to work with people like Congressman Lucas to make sure they stay there. This district has about 14,000 farms and ranches and produces almost $1 billion worth of agricultural products every year, the majority of whom, by the way, are exported beyond the United States. So believe me, we will look very carefully at protecting Oklahoma agriculture.
Okay, our next question comes from Vicki from Newalla.
Hi, Vicki. This is Tom Cole.
Hello, Mr. Cole. Thank you for taking my call.
Thank you for calling.
My question is about nursing homes. I understand about no visitors, not carrying in germs and things like that to keep them safe. But I don't understand why hospice isn't allowed in. to see, the patients on hospice, because that is part of their essential care. They're a care team. And I was wondering if they could look at that and maybe, do some twerking on the visitation at nursing homes.
That's an excellent point. Obviously, in hospice, you're dealing with a situation that's near end of life, and you're trying to make somebody comfortable. It's not a question of endangering somebody, that's otherwise healthy. So, the formulations right now, the regulations are being decided at the state level, not at the federal level. There's been recommendations. We did have that awful instance in the state of Washington where just before we really knew what was happening, and 20 people died in a nursing home. It gives you how deadly this is. By the way, so far, at least as of yesterday, and these numbers change every day, the average age of death from this is 81 in the United States. So it's very deadly to people sort of over 60 or much more dangerous. And then if you've got a underlying condition, particularly respiratory disease, really, really dangerous. We don't have any instances, I think, in the world of anybody under 10 years old dying. It's a very different kind of virus, but it really focuses on older people. For most people, again, the vast majority of people will not be infected in all likelihood, or the great majority, and 80% of the people that are will either not know they had it, or it'll be very slight. But for about 15% it gets serious, and then for 5% or so, it's very serious and very lethal. So let us make a suggestion to the governor's office, because again, we're not setting those rules. That authority is at the state level as to what the visitation. Now, the Center for Disease Control is making recommendations, and I know the governor's office and the state are working very hard to follow the best medical advice that they can get. But I think they do have the power, and my guess is they probably will be looking at this. But let us raise that issue. But I don't think we'll be impacting it with legislation. I think we'll leave that authority probably in the hands of, like, the State Nursing Home Commission, so that decisions can be made by Oklahomans that affect Oklahomans at the local level. We're not trying to impose a one-size-fits-all from Washington, D.C.
All right, we'll move on to our next question. It might be our last question. We might have time for one more after that, but this one comes from Robert from Chickasha.
Hey, Robert, this is Tom Cole. How are you?
Hi,
hello.
Is this Tom Cole?
Yes, sir.
Can you hear me?
I can.
Oh, hey, thank you for representing Oklahoma so well. Appreciate it very much.
Thank you. You're very kind.
Well, I have a question. I'm not sure if it's really more directed to the state level, but I wanted to ask,
Sure.
Some Oklahomans are doing quite well and have some financial success. And during this downtime, if you want to call it, there is the opportunity to volunteer. There's opportunity to maybe provide some financial assistance for those that might not be so fortunate. Do you know if there is anything in place in Oklahoma to help receive that, or is it still maybe Red Cross, things like that, or is even the Red Cross still, involved in this?
As far as I know, it's the latter. That is, just encourage people to give locally, but we'll be happy to check, and if we can find out, we'll put it on our website or try to get that information out. I think you make a very good point, and we all have our favorite group of charities. I think in Oklahoma City, the City Rescue Mission, just put in a plug for one that I like, which really helps people down and out. And but there's a lot of them out there. But look in your neighborhood. There's going to be some people going through some tough times in your local community, and just try to give them a helping hand if you can, because most of us are going to be fine, but some of us either because we're going to get ill, or somebody in our family is going to lose their job. We're going to have a tougher time, and that's when I saw the governor making this point earlier today. I was very proud that he did. We need to look after one another, reach out, and protect our friends and neighbors. And so, thanks for raising that point. We'll see if there's some special program, but most people, know in your communities. I actually was on the phone earlier today with the guy that runs the National Alzheimer's Association. They do a lot of nonprofit work, and they look after a lot of Alzheimer's patients. They don't just help find the cure. They help families with care and whatever. And of course, this is a time when, when people get worried about the economy, they hold on to their dollars. And he was making the point, some of the tough decisions. He wasn't asking for anything, just, hey, we're going to have a tough time here working through. So, please encourage people to continue to be generous to their friends and neighbors so that we can continue to help people that need help. So yours was a very timely point to be made.
Okay, I think we have time for just one more quick question. Ralph from Newalla, you're live.
Hey, Ralph, this is Tom Cole. How are you?
Hi, Tom. Me and my family are hanging in there. I'm a retired military guy and now a math teacher at a high school level, and so I got a little extra time on my hand. But my wife and I were sitting around talking about how the government and these different programs could help different families, and she brought up the thought of, have they looked at the banks and credit card interest rates and doing something about, I don't even know, lowering that, holding that, so that...
That's a great question. Yes, they have. The Federal Reserve, which really sets the basic interest rates, have basically lowered it to zero. In other words, so banks and financial institutions and lending companies, they all are getting money about as cheap as you can get it. I mean, basically for free. And then the thought is that should bring their interest rates down as well. I'm sure the Fed will be monitoring that, so we don't order them, we don't set the rates, but when you lower the cost of what they can get money at, the expectation is that will be passed on to the consumer. So, but again, that's something we'll bring up as we talk legislatively about what we could do next. We do have an independent, Fed is an independent agency. The president appoints the director and the various board members with the consent of the Senate, but he doesn't order the policy. But this president's pretty aggressive about saying he thinks the interest rates have been too high, and I have to tell you, in the last 2 or 3 weeks, they have come down dramatically. And so hopefully that savings will get passed on to you. People can either refinance their homes, or certainly if they're in the market for a house, a car, a major purchase where you go to the bank, they should probably have the best rates that they're going to have had for a long time.
All right, we have neared the end of the telephone town hall. I'm sorry we couldn't get to everybody's questions tonight, but you will have the opportunity to leave a message and receive a call back from our office after Congressman Cole provides some final words. But before I move back to the Congressman, just wanted to remind you that if you would like to opt in to future calls like this, press 1. To opt into future calls like this, press 1. Congressman?
Okay, first of all, Sarah, thank you. And I want to thank all of you that took the time to listen in to all or part of the call. We appreciate that. We're not able to get out and around as much as I would like, and we normally do, town halls until we get through this. We'll probably be doing a lot more of these, so I hope this format works for you. And if you like, follow Sarah's suggestion. If you just want to automatically be included, we can't call everybody in the district when we do this, but we literally call tens of thousands of people. Second thing, remember our offices will be up and functional. So if you've got a veterans case, you've got a Social Security concern, you can still call the number. It'll be switched to the staff person that works after that, and we're certainly anxious to continue to try and help you. We're also interested in your thoughts and suggestions on legislations. We try to move forward through this. Finally, just hug your family a little bit, pull them closer, be kind to your friends. I guess don't get too close to your friends right now, but check in on them, and particularly check in on folks that are 60 and over and might be alone. Make sure they're okay. Make a call every now and then and see if they need anything. If you can bring them anything, the less they're out, the better off for them as we get through this. And I know it would mean the world to them just to know that a family member or a friend or a neighbor is thinking of them. That's about the best thing any of us can do. Last thing, I will just tell you, we'll get through this. Our economy is an incredible economy. The American people are an amazing people. They know it. They take things seriously. You can see how much private action there's been the last week or 10 days as the crisis has gotten a little worse, and they've begun to think, well, what can I do? And you see everything from very, very dramatic actions like decision to close down events to which is made by the individuals in charge of those events, to people just reaching out and checking with friends and neighbors and seeing what they can do. And finally, as Robert from Chickasha said, if you're fortunate enough to not be needing something and being if you can help with a donation or a contribution to those agencies in your community that are looking after people and trying to help in a time of crisis, that would be a wonderful thing. You'd I'm sure earn blessings in heaven for it, but you'd also have the satisfaction knowing that you're doing something to help people that through no fault of their own are in a little bit more difficult circumstances than they had any reason to expect. So again, thank you for taking the time to listen to the call. We look forward to keeping you informed in the weeks ahead and look forward to working with you. So thank you again and have a great evening and a blessed week.
Thank you, Congressman, and thank you to those who joined tonight's call. If you'd like to leave a message, press 1 now. Again, to leave a message, press 1 now.